If there's one health condition in babies that is both frustrating and weirdly controversial, it's infantile colic. The controversy comes in multiple forms, with many conventional pediatricians still mistakenly stating things like, some babies just get colic, and don't worry, they'll grow out of it. And at the same time, there is all sorts of debate as to how babies get colic in the first place, and what the real root causes are. In this video, we'll break down the real science behind colic, keep it super simple, and get right into some safe and natural ways to help ease your little one's constant crying and discomfort. This video is for parents of babies struggling with colic, desperate for answers and relief from the constant crying and sleepless nights, who also know that it's not normal that they are so uncomfortable, constantly crying, and also physically uncomfortable and constantly arching their back and cranking their neck as they try to find relief. We're revealing how optimizing vagus nerve and overall neurological function could resolve many of your child's health struggles. Learn gentle ways to stimulate the essential part of the nervous system, plus specialized chiropractic care to detect and address vagus nerve dysfunction without drugs and surgery. So as a baby, Jackson struggled with bad reflux, gas pains, and trouble sleeping at night. Mom said, it was very difficult for us to try and navigate being first-time parents and having Jackson struggling with these issues. It was hard to see Jackson so upset and unhappy because he was always so uncomfortable. So they took action and they brought Jackson to their amazing holistic pediatrician, where they're always looking to find the root cause of a child's struggle and not just put a band-aid on the symptoms. And for Jackson, they knew the stress of a very fast labor and delivery was part of the root cause, so they were referred to a PX doc's office. Mom said, we are so thankful to have a pediatrician who right away recommended chiropractic once we brought up our concerns to her. And here's how it went. Mom said, Jackson started getting adjusted when he was 9 weeks old. And within the first couple of weeks, we definitely started to see changes. We first noticed that he was no longer having constant gas pains and didn't seem uncomfortable anymore. Within the first month, his colic seemed to disappear, and we started to see Jackson's happy and silly personality coming through. I love that part. With continued care, Mom said he was a completely different baby than he was when we started. His colic and stomach pains were completely gone, his reflux better than ever, and he was even sleeping throughout the night. Now, as a toddler, Mom says, he is truly the happiest and always smiling and laughing. We cannot be more thankful to have found our PX doc's office. They've taught us so much about chiropractic care and the benefits it can provide to Jackson. Thank you for giving us our happy boy back. Pretty cool. We could not be happier that Jackson is thriving, happy, and healthy, all natural and all drug-free, and with the best parents he could possibly ask for. Jackson's integrative pediatric office referred him in for chiropractic care, and that we also strongly encourage parents to find a holistic and integrative pediatrician or nurse practitioner. See, the vast majority of colic patients we see at Innate Family Chiropractic have at least one of the following hidden in plain sight stressors in their case history. So number one is a high stress or high risk pregnancy. 2 is a birth interventions like forceps, vacuum extraction, induction, epidural, or C-section that can physically injure and alter the function of the nerves and muscles of the upper neck, that then control things like sleeping, latching, and breastfeeding, swallowing, digestion, and gross motor development, like turning the head, tummy time, and so forth. These 2 very common initial stressors cause the infant's nervous system to become highly sensitive and stuck in what's called sympathetic fight or flight mode. Once that subluxation and sympathetic dominance sets in for the infant, they struggle with basic health functions like sleeping, eating, pooping, and moving. When their little one is constantly crying and uncomfortable, parents innately know that something within their little bodies is not working well. and that includes both internal muscles that control digestion and the external muscles of the neck and spine, which is why infants struggle more after eating and are constantly arching their neck and back. In today's world, by the time we get to assess and examine a colicky infant, many times their amazing moms will have already removed dairy and other common foods that have a higher risk of allergies and intolerance. And many families today have also already had their children's tongue or oral ties surgically revised and clipped. Now, while tongue ties and oral ties absolutely cause an infant trouble with latching, nursing, and can be uncomfortable, it's important to continue to look deeper at what the real root cause of even these tongue ties are. While we may sound like a broken record, which is what we want to be, it's important to know that if a child's nervous system is stuck in a sympathetic fight or flight mode, it will leave all the muscles and ligaments of the body extra wound tight and tense. So even if the tongue and oral ties are surgically revised, the tension will remain on the nervous system and throughout other important parts of the body. While most everyone will look to the stomach or digestive issues for the root cause of colic, often it's found even deeper within the nervous system and its control and coordination of digestive motility, absorption, and elimination. When tension and subluxation build up along the neurospinal system, a colic baby will often arch their back and crane their neck, trying to release or dissipate that tension themselves. When this occurs, it is an almost sure sign that the root cause of their discomfort is neurospinal discomfort and tension, not merely digestive dysfunction. At Innate Family Chiropractic, our compassionate doctor is specifically trained to help identify the neurological factors behind colic and gently restore your baby's nervous system balance and comfort. We use a combination of thorough assessments and advanced technology called neurological insight scans to detect and measure the presence of subluxation and neurological dysfunction, or sympathetic dominance in colicky infants. If you're ready to find real answers and drug-free solutions for your baby's colic, click the link below or in our bio to visit our website and schedule an initial consultation. Let us help you and your little one find the peace, comfort, and restful sleep you both desperately need. Don't spend another exhausting night wondering if there is hope. DM us if you have any questions. Our team is ready and happy to help.